Before we get started in this episode, a quick announcement. As you know, I'm very passionate about acceptance and commitment therapy, and I also run a busy practice in Canberra. We're currently looking for psychologists who are registered in Australia to join our team, who are also passionate about learning about ACT. We provide supervision on a group and individual basis and training around ACT. So if this is you, if you're interested, please express your interest at strategicpsychology.com.au/careers. Look forward to hearing from you. And now back to this episode.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking. Yeah, better thinking. Time to tune in. Let's go.
Welcome back to Better Thinking. My name's Nesh Nikolic, and my guest today is Dr. Jodie Fleming. She is a clinical and health psychologist with a special interest in chronic illness management and psycho-oncology. Jodie interned in the Psycho-Oncology service at the Mater Hospital and worked at the John Hunter Children's Cancer Hospital in Newcastle, New South Wales. She has also worked in an outpatient mental health service and in a hospital rehabilitation ward treating patients with a variety of health conditions, including cancer, diabetes, stroke, and chronic pain, to name a few. Jodie has also been involved in the oncology rehabilitation program at St. John of God Healthcare and is currently running psychology sessions in the survivorship program at Southwest Healthcare. Today's conversation moves from understanding chronic illness management to finding value during difficult times and also seeking spaces to grow both as human beings and as psychologists. I found this episode personally moving as I think it asked me to grapple with my own sense of humanness and ask some bigger questions. Hope you enjoy this episode. Jodie, a big thank you for coming onto the program today.
Thank you so much for having me. I still think you found the wrong person.
Look, I'm very interested to speak with you, and the reason for reaching out is to learn a little bit more about the world of, chronic illness and that management, and in many ways try and find that overlap, at least for myself, of understanding how that might look, not even from just a disease sense, but the way that we live as human beings. It feels to me, at least part of my philosophy, is that we all have, in some sense, a chronic illness called being human, that we're all leading in that direction. That's certainly not taking away from those who have a medical illness, but it does, in my mind, pose this question of a reminder of us being here very temporarily on Earth, and obviously for chronic illness, sometimes that's much shorter, sadly, and for others we can somehow try and find a way to manage it. But really looking forward to speaking to you about this world and hear about your experiences, and we can meander from there.
Awesome. I love that idea.
How did you get into this space, if you don't mind me asking, to get started?
Oh, well, it's a funny, my pathway into psychology is a very long, meandering pathway, actually. I am one of those people, I didn't prepare very well in year 12, I don't think. Although I had the goal of wanting to be a psychologist, I didn't get the marks I needed, and so took a different path straight out of high school. And I ended up becoming a myotherapist. And a myotherapist is pretty much a remedial massage therapist. And one of our placements, this was in Melbourne at the time, was at I think it's called the Fairfield, it was a rehabilitation hospital. And at that time, this is like the early 90s, they had a ward where people were still living in iron lungs. I know you're going, where are we going with this? But so we went in for this placement. I think we went in once a week for a period of weeks, and we would, massage these very, very, solid muscles, these poor people who are, lying inactive, and, being able to chat to them and, kind of see the human side of their experience of living in an iron lung, which and if your audience are not quite sure what that is, maybe Google it, but be prepared to be quite confronted. But also at that hospital, there was a cancer ward, and there was also an HIV/AIDS ward as well. And I remember being very clearly struck by the idea that if I wanted to make a difference in the world, if I really wanted to help and contribute in some way, that I couldn't think of a better way than to help people and their families who were going through a cancer experience. And I didn't even go near the people with cancer while we were doing these placements, but I guess my head started moving and my heart into, that health realm then. Anyway, fast forward quite a few years, I was living overseas, and I was kind of got that little niggle to, go back to psychology. I've always been fascinated by human behavior. I love people. I love connecting with people. I love helping people. I just love people. And I was kind of toying with the idea of, okay, well, I might go back and study again. And I managed to find a distance education, like a degree that I could do while I was living in Spain, through Deakin University. And back then, like, I think we did have the internet because there was email, but back then they would mail you like your hard cover books and notes all printed out, and you'd get them in the mail. Hilarious. And I remember going into the Australian Embassy and doing my exams and all of those things.
I remember the reading bricks and everything else that you'd have to go and pick up.
So funny, but I love highlighting, so it was my jam, totally. So it wasn't until, then kind of late 20s, early 30s that I went back into studying psychology. And by that stage, well and truly had my heart set on becoming a psycho-oncologist. And at that point, there was a book called The Human Side of Cancer by Jimmy C. Holland, who worked at Memorial Sloan Kettering, which is a cancer hospital in New York. And she was the god of psycho-oncology. And I devoured anything and everything she wrote and said. And throughout my training, every essay, my thesis, both theses, the fourth year and my doctorate thesis revolved around, themes within psycho-oncology. And everything went according to plan. And I, did my placements. I managed to do one at I was living in Newcastle at the time, at the Mater in Newcastle with some wonderful colleagues, and learnt so much. And that was about the same time that I was learning acceptance and commitment therapy. We all were. It was kind of, I don't want to call it a circus, but, the training came to town. Sure. And everyone jumped on board, and so a lot of what I was experiencing and learning in that placement was related to ACT, and that just opened up a whole world to me. Because I don't want to say anything bad about CBT, but it felt very limited. I was noticing it was very limited when I was working with clients, and ACT just seemed to speak to my soul a little bit, I think.
It just resonates for some, and it doesn't take away the value from CBT, as you obviously note, but when it resonates and it makes sense, it makes it much more accessible for the clinician. And then obviously I think it then allows it to be much more accessible to the client. Can I just jump back a moment and just ask you about the interest in oncology? And I ask the question because not only psychologists, but I think humans in general, we are so afraid of going into difficult areas, whether it's, working with people who are, in the criminal system, whether it is around obviously death and dying, terminal illnesses, or at least the fear of. they're areas that we don't like to go in as humans, and I think that also is true for psychologists in general, on a general sense as well, because we're human first and then we play a psychologist role. What was it that grabbed you about that space? Because it's quite unusual, at least it feels to me.
I think because it is so difficult and many people do find it so difficult, that's why I chose it. I think I was looking for where I could make the biggest difference. And I remember thinking to myself that, what would be one of the hardest things to ever go through in your life? And having cancer or losing a loved one to cancer was what I came up with. And so I think a big part of that that desire came from that. I knew it would be hard because I think also, I listened to your episode on death anxiety, and death anxiety forms a big part of the work you do in Psycho-Oncology, and our human brains, our very primal human brains are hardwired to avoid death. And in part, I sometimes wonder, this is with hindsight looking back, whether my own fear of death was a big part of why I wanted to work in this space as well. That wasn't conscious, that part of it, but I do think looking back now that perhaps that played a role for sure. It's tricky. So I was well on that path when I met my now ex-husband, who was a friend of mine from high school. So we had a long friendship history, and we met again back in the hometown, Christmas Eve, and he had just had surgery for testicular cancer. And I was like, wow, here I am studying all of this stuff, and then in walks this man. And it was right at the time that he was about to start 6 months worth of chemotherapy. Like back then, it took forever. And even 13 years ago, well, I'll get to that. But so that was when was that? The early 2000s. And so then I essentially became his person through his cancer journey. And I got that, firsthand, carer, quote unquote, experience. And I was thinking to myself the whole time, this is fantastic. What an opportunity. I'm really getting this firsthand experience. Not only am I working with my, or will I be working with clients who are going through this, I'm learning so much about it from this personal perspective as well. This will really make my work more, enriched and deep, and I don't know. So that happened as well, and that kind of just further solidified that, yes, I'm on the right path. This is what I want to do. Yeah. And then 2 things happened straight out of university. I got a part-time role in a children's cancer hospital as a psycho-oncologist. And then I also worked part-time in a private practice. And within my first couple of weeks working in the private practice, I had a new client. She was 36 years old, mother of 2 small children. And she came to talk to me about something, whatever it was. And at the end of the appointment, she said, "Oh, I'm off to have an ultrasound on my breast now. I found a lump. It'll be just my luck. It'll be cancer." And we both said, "Oh, don't say that. No, you'll be fine." All the platitudes. And off she went. And then 2 weeks later, her name was in my diary again. And she came back. It makes me emotional to think about it still for her. It's very strange. She came back 2 weeks later and told me that, in fact, she'd been diagnosed with stage 4 breast cancer. Mm-hmm. And what she wanted was for me to she wanted to work with me so that we could help her children, so that when she wasn't here anymore, they'd have someone to talk to. And she just taught me so much about living and dying. 10 months later, I visited her at home 2 days before she died. And she said to me, I would rather have lived the last 10 months the way I did than to have lived to 80 living the way I did before she knew she was going to die. And we did a lot of ACT work. And I just thought, it's, in ACT training, they get you to do the funeral eulogy or the 80-year-old self-reflection. And I think about her all the time, and about how, choosing the life that you want to live, regardless of dying with cancer, and how happy she was at the end. Like, it just taught me so much. And then, of course, working in a children's cancer ward, which everyone goes, oh, how could you do that? That must have been so horrible. And yes, it was, because there was some, we lost some patients, of course we did, but not as many as you think you might. Treatments are so good, and I imagine they're even more advanced now. But it is a very challenging time for families, for siblings, and of course for the patient as well. But when you've got 4-year-olds, 8-year-olds, there was one very special 8-year-old who I write about in my book, who he just taught me everything there was to know about not fearing death. And he's, I think he's like 21 now. I still, he pops up on Facebook every now and then, and I just think about my clients, my patients who have taught me so much more than I ever could have taught them. Such an amazing space to work in.
It's so incredible. I reflect as you talk about my understanding of life and this whole concept of being human, and that itself is, a terminal experience. There's an end point to that, and I don't think I understood that very well until my best friend was diagnosed and died from cancer. And even though that opportunity to learn was there with others, I've had other family members pass away, friends of the family and the like, as we all have. If you've got to our reasonable age, you've seen at least some of it. At least most of us have, but it didn't ever strike me as it did once it was that close. And and there's almost, hearing you talk about it, there's almost I feel like a similarity there, that there's a positive side as well. There's something to try and embrace, like your client who said those 10 months, clearly she learned something, she understood something shifted, that it made a difference in the way that she lived. And I remember my friend, how he was through his couple of years of treatment before his passing. He was strong, he was stubborn, he was fighting the whole time, and I celebrated that in my mind, and with him as well, about saying, do it your way, go out fighting, and that was important, I think, for him to do. And there were those harder times when you'd kind of drop the fight, going, oh my goodness, I think it's got me, and then you'd kind of fight again, and it's like, you do it in your way, mate. There's something special about that, and so it kind of grounds us if we have that opportunity to try and reflect. And it sounds like some of those clients, whether it's the first client you spoke about or the 8-year-old boy, that they are such frightening times, but there's sometimes something to get from that. And I say that with the utmost respect for anyone listening as well. Often those things can't be understood immediately, and for some never. So for some you can never find that, and that's okay too. There's not a requirement to find anything. It's time to be respectful and thoughtful for all people, the person passing, but also the loved ones remaining.
Oh, and it's such a personal experience, and everybody does do it differently, and yeah, everybody has a different capacity, don't they? We think about stress-related growth or post-traumatic growth. It's such, when you're somebody who can experience that and grow from adversity, what greater gift in life is there? Because I'm thinking a couple of things as you're talking as well. I keep thinking about that Buddhist quote, the problem is we think we have time. Like, I think, when there's when we're not facing or having to face our mortality, getting to 90 seems like a given, and it seems so far away. And so, there's that tendency for our brain to always overestimate how much time we think we have as well. And so we'll say yes to the things that may not be so important to us because we think we've got time to do the important things later. And yet, this is what I love about ACT so much and positive psychology. It really reminds you that you need to be really conscious and intentional with what is valuable and what's important to you. Because if you don't start investing your time and your energy and your heart in things that are important to you, everything seems equally important. But everything is not equally important, and especially when you've got a limited time. So I think that is the true gift that comes with something like that. You don't have all the time.
It's so beautifully said, because it is very much that about trying to understand not the theory of values, not the book interpretation of living a life that is based around who and what's important, but in actual fact doing so. I think when something like this presents itself through, whether it's cancer or other chronic illnesses, or sometimes even the fear of that we found a lump but we don't know, that's a moment that has potentially provided itself to learn from, and it's hard to kind of continue to remember that. And sometimes chronic illness, the management of does provide that opportunity. But especially I can't imagine with little ones what that's like. I very much resonate with what you say. People are like, what? How could you work there? And then at the same time, I resonate with but this is the most important work as well. Where can I do something really important? It's not the most important, my apologies, but where can I do something incredibly important and helping others in their greatest need, is just so impressive. And we need more people like you willing to step into that area and say, I don't have to, I want to. It's important.
What's interesting with that though, there's, and this is another human fault, flaw. We always think bad things happen to other people. Like there was, and not that this was conscious either, but I'm working in this space with people who have cancer, and my role is to help. I'm the helper. And somewhere in there is a belief, a subconscious belief, that this happens to these families, but it doesn't happen to mine, or it doesn't happen to me. And I mean, given that my husband at the time had cancer, I mean, obviously, clearly I knew that it could, but maybe even within our family, I thought, well, it's happened to him, it won't happen to me. And not that I don't know, like you don't even think about it as a possibility until it happens. because, spoiler alert, in 2010, just at the point my marriage did end, actually, I had found a lump and had gone to the doctor and had a biopsy on it. And it's a really interesting thing because you become, I guess, overly anxious. There's a real health anxiety when you're working with people with cancer. And even though I'm just contradicting myself because I said there's this belief that I wouldn't ever get cancer. And I think that was there. But at the same time, so too was, oh, here are these lumps, and a bit of hypervigilance about checking and, doing the right things because you're seeing people who look like you and who are your age and, do the things that you do and move in the circles that you move in, and they're getting it. So our brains are always weighing up, that doesn't want to believe that anything bad can happen, because I think that's our very strong survival instinct, isn't it? But then at the same time, survival tells you go get checked, make sure that you are healthy and well. And what you said before about, even, have finding a lump, and there's the Schrodinger's cat, it's both there and it isn't at the same time. And sitting in that space can be enough to give people perspective. That can be like, whoa, that was a near miss. Okay, now I want to, reorganize my priorities, and I want to, choose differently for myself. I'm so lucky, or whatever we might tell ourselves, whatever the story is. And then there's so much to talk about, because then you get the lump, and then you get told the thing, you have breast cancer. And the way mine happened was fairly horrendous. So I was working at the Kids Cancer Hospital this day, and I'd had the biopsy, and I was going away for Easter. So it must have been the Wednesday before Easter, and I was flying to Melbourne on the Thursday. And we didn't have phone service in the hospital. So I came out at the end of the day, and I was actually going between the hospital and private practice. And my phone pinged that I had a voicemail, and it was the GP. And I'm not sure that GPs ever leave messages, like this. But it was, Jodie, we've got your biopsy results. I've scheduled you an urgent appointment tomorrow morning to come in and discuss them. And hang up. So, of course, I'm walking to my car, and I felt like I'd just been, hit by a bus. It was horrendous. I couldn't breathe. And it was a funny thing, because I got in the car, and a lot of my clients who I'd worked with, including the lady that I was talking about before, came into my mind, and I sat there and I consciously thought, now I get it. Now I get what being told something like that must feel like. And then the next part was, I just felt so ill-equipped and redundant in whatever it was I had tried to say or do with them to help in that moment, which was also amazing, because from that point on, every experience that I had completely changed the way I worked with people with cancer. And not that I recommend having a personal experience to get that insight, by no means. But I was able to look at the tools when I eventually remembered that I was a psychologist, and I probably had some, and go, oh, I would never even mention that to someone ever again. But here are some that worked really well, or here are some that worked reasonably well, and maybe they worked for some people, didn't work for me, but it might for them, or whatever. Yeah, so very, very fascinating, experience.
Jodie, could you try and put words to it? I know this is very difficult, but can you try and put words to what it means, that now I get it? What was it that you got?
I think I got my mortality. And I think, I think that's what I got.
Mm.
I think it's, you've got somebody who's been diagnosed with cancer, and by the time they get to you in your psychology office, the shock might be wearing off. They're probably in, at least planning mode. They're finding ways they can start to take control, or at least you're there to help them find those ways. And they still look like them, So they can sit there and they can cry and they can describe it to you. And I thought I would, and I think we are very good at empathizing. But like you said before, we watch a lot of people suffer every day. And I don't know whether it's a part of our own, professional boundaries, or, our own, self-care, that allows us to have that emotional distance that lets us keep turning up to work every day, really, and that prevents us from burning out. But having it happen to myself, I think I was also acknowledging, I thought I understood what they were telling me and showing me, but now I understand.
Mm.
Yeah.
It's that idea of it happens to others. I still know my mortality, but it happens to others, versus I know my mortality and it's happening right now.
Yeah.
That the clock has moved forward, and
very quickly.
I didn't know that.
Yeah. Big.
It's immense, and that's something that you're able to hold and have when connecting with others, when understanding others in a unique sense, in that it's actually occurred for you, and to you. I hope you're doing well today, and I can't imagine how that would have changed your practice. Can you talk me through that, if that's okay? That you were working still with people in that exact space at the time?
Yeah, I look back at that now as well and go, wow, what was that? What was that choice? So I had moved to Warrnambool by that stage, because I wanted to have treatment where my family were for support. And I'd gotten the most incredible job at the hospital, St John of God Healthcare, and I was working both across the health services centre, which is the rehab department, and also the outpatient mental health service, which was really kind of like a private practice. And I think, well, so a lot of change had happened. I'd had to leave my city. I had to leave my friends. My marriage had ended. I had to leave my house. I had to leave good weather. I left my doctor. I left everything. And I think I wanted something to stay the same. And I also knew that I needed to be doing something. So I needed to work. And I got that amazing job, and they were wonderful, and they were very flexible and told me to have all the time off that I needed. But I needed something to stay the same, and I knew that I couldn't just sit around it. Like, I'd moved back into my mum and dad's. I was 37. I'd never felt like such a failure in my entire life, and I couldn't just sit there all day thinking about how bad my life was. So I went to help other people. And it was amazing working. So what would happen was I had 6 rounds of chemotherapy. And for the week of chemotherapy, I didn't work. Like, I'm not that much of a crazy martyr. but the the 2 weeks in between I did. So it was 1 week off, 2 weeks on. And and this might sound grandiose, or it might, I don't think it was grandiosity at all, but I felt like, I have even more to give now because I am aware of this personal perspective of it. And I wasn't seeing a lot of people with cancer, as I explained. I live in a, it's very general practice. But for example, there was a lady who contacted me who we had very similar trajectories from diagnosis through, treatment types and so on. And she asked if I would work with her children. And I thought, okay, well, that's a degree removed. And I've worked with kids with cancer before, and I've worked for Canteen. So I had a lot of experience working with siblings and children. So I said yes to that. And she and I kind of formed a bit of a peer relationship. And I know we're not supposed to do the whole dual relationship thing, but it's really tricky in small towns. And we were finding ourselves at, similar events and things. And just by the nature of the beast, you want to connect with someone who really gets it. And so there was her, and there's one other person that really comes to mind. And it was another lady who was probably, I don't know, she was a bit older than me, but had exactly the same diagnosis. Anyway, my oncologist had double checked, are you sure you want to work with cancer patients? And I'm like, yes, I can do everything. I'm fine. So she referred me some, and she referred me this lady. And this lady, though, was my biggest lesson of all, because she sought other opinions, and she also pursued an alternative treatment pathway. And she would come into our sessions, and she would talk about statistics in ways that were very not helpful for my mental health and well-being, because they immediately would trigger my death anxiety, and I'd be not able to focus or concentrate. Sorry, there's a dog barking outside in our session. And obviously I then had to terminate therapy with her and transfer her across to another clinician. And at that point I was able to go, probably shouldn't be working in this space. It's probably a bit soon. And made the decision to have a big break, and probably didn't see anybody with cancer for more than 5 years after that, because of that transference stuff, counter-transference stuff. But in terms of working with people, it was also, I'm going through chemo, and I struggled big time. The first 3 cycles of chemo were like nothing I could have ever prepared for or imagined. And I would literally lie there for 5 days, because you get chemo on a Tuesday, and I would lie there from that point forward until Sunday about 5 p.m. It was like clockwork. But it was that I had the darkest thoughts of just not wanting to be here anymore, because I didn't think I could do it. It was so awful. So I spent 3 cycles like that, and I think I just got sick of myself, and I was like, come off it. Like, it doesn't have to be this hard, surely. Surely there's something that can help here. And that's when I remembered, you're a psychologist, mate. You used to work in this area, you studied in this area, you know some things. How about you go looking in your toolkit? And I pulled out mindfulness of emotions, and I pulled out the self as the observer, and I pulled out acceptance, and I pulled out willingness, and I pulled out my values, and put it all together. And it started with the worst side effect from the chemo for me was just this unrelenting nausea. And so I began with that. And I began just visualizing what shape, if I traced the outline of this feeling, what shape would it make? If I could touch it, what would it feel like? If I could smell it, what would it smell like? If, is it hot, cold, whatever. And what I noticed as I was moving through that practice was just this little drop in the intensity of the nausea. And I had a reprieve, and I was able to make a choice to watch an episode of Friends, or pick up my book, or have a sleep, or something that I wasn't able to do while I was busy struggling with the nausea and wishing it was different. So that began my true love affair of mindfulness practice. But also, I think, really using my values to motivate towards choice, like in terms of how I was living my day and my life, and really having to look at my thoughts and the stories that I was telling myself, because I literally went from, I don't want to be here anymore, like those kinds of thoughts. And imagine thinking that day after day, week after week of chemo, like, just horrendous. To my story flipped a bit, especially on that Sunday when the sun came out, to, I'm as strong as an ox. Look at what my body's doing here. I was so proud of it. Like the minute I found out I had a lump, I fell in love with every part of my body, to be honest. And I tried to create a relationship with that lump, because I was thinking, I don't want it going rogue and spreading everywhere. Let's just be friends. And I don't know, everyone has their different ideas about how this stuff works. And back then I had no idea what I was talking about. I didn't even really understand the real power of, the food we were putting into our bodies and the impact that could have. Or I know a lot more now. Probably just lucky I survived to get through to learn this stuff now. But I think I really learnt the power of mindfulness, the power of our thinking processes, and how that impacts the quality of our life and the satisfaction we have with our life. Because I could still feel quite satisfied with my life even though I was in bed for a week. I didn't have to be, if I was telling myself I could have been traveling overseas, but no, I'm here with cancer, I'm going to end up feeling a lot less satisfied, suffice it to say. So I think, being able to then say to clients or patients, this is how I used it, or and I haven't given you a very in-depth description of how I've used anything, but this is how it worked for me. This is when it worked for me. This is when it didn't work so much, and that's when I turned to this instead. Being able to do that, and I think it helps motivate people persevere with the practice, because we all know none of these things are going to work straight away. They all require practice and patience and consistency and effort, and they're not always going to work in every scenario. But I think even in being able to share that personal experience has been helpful to some of my clients, at least in the persevering and committing. Yeah. I don't know if I answered your question then.
Absolutely. Did you find yourself connecting with an area more so than another? You described, in some sense, creating a relationship, or we could call it, creating some distance or separation between you and the cancer, and that it was almost like an embodied thing. It was an entity that's separate to you, but not one that is in a place of struggle, but rather that you're trying to, in some sense, have some harmony in between the two, to kind of say, if we treat each other respectfully you won't spread, and moving away from not getting caught up in the medical stuff. But there was something obviously about that of your relationship with it, so to speak.
Yeah, and that was just something that happened innately. Like, I don't even know that, if someone else had have sat there telling me they did that, I probably would have gone, all right, okay. Yeah. But I did find it certainly helped me cope. And with all of the training and the reading and so on that I'd done up until that point, I was actually, we didn't have a lot of research or evidence to suggest at that point that, our mindset could actually have an impact on our survival. I think there's a lot more coming out about that now, and don't ask me about it because I'm not all over it. But I feel like what I did know was that what I did here could help me cope better. And if you're going to cope with something, do you want to struggle, or do you want to actually cope in an adaptive, helpful way? And I'm certainly not talking about avoidance at all, but actually really embracing and accepting this is happening to us. And I think a lot of people will identify, with the self-criticism that we have for our bodies, especially women, but men as well, all humans. We can be so critical of the way we look. We can be critical of the smallest things. And, we know even it's such a subjective thing, but even the most, what we might think is the perfect looking model has their own, inner criticisms about their body. And what I chose to do, not only with, the lump, but with my body in general, was to become its biggest cheerleader. Because, I recognized it had a lot of work to do. And there was a lot going on too around fertility at that point, because I hadn't had children. The marriage had just ended. And I was busy scrambling to try to preserve my fertility before chemotherapy started. And I ended up feeling quite a huge amount of compassion for my poor body, that for everything that it was going through. And then later, grieving for everything that it wouldn't go through. I'm so surprised how emotional I'm getting talking to you. You must be a psychologist. Yeah, so maybe that was my introduction to self-compassion as well, which is a really beautiful thing I'm only kind of coming back to now, because it's interesting when you were talking before about, we get this perspective, and if you have a lived experience or, a close degree of separation experience of somebody else, facing that mortality, you think that that's it. You think then, oh, she's had cancer, she'll be like, she's going to live this most amazing life and she'll never take anything for granted. And yeah, it kind of wears off. 4, 5, 6 year mark for me, and you get back on the treadmill, and you
it's so much of it
into those habits.
Yeah, it's that humanness, the human condition, which there's so much functionality around as well, that we're not completely fused with what might occur. Similarly, also trying to, in some sense, appreciate the importance of utilizing today and tomorrow and the next day. And it sounds very much from your description, and I probably didn't give it the justice in the way that I spoke about it, only exploring the one element of you relating to the cancer as, being distinctly from you. But in actual fact, you mentioned dozens of things that you were doing. It was very much process based. It's not this, you do diffusion, and I think that's part of the challenge with, I think, the ACT world in training, and I'm guilty of that myself. When we're trying to train or teach therapists around ACT, we kind of grab these easier segments, we call them the 6 core processes. And I think now, having spoken to Steve Hayes and certainly looked at his work a whole lot more, and people like Stefan Hoffman as well, the process-based space has a lot more, I think, to be discussed than the these elements, that there's all things occurring, and we're moving around that, but with an essence of whether it's psychological flexibility or an essence of the observer. If I kind of observe myself, even, I would say that I have a sense of urgency to try and do what's important now. And it's really funny because even in that, there's some fusion going on, that I, I'm kind of feeling like something has to happen. I've got to be doing so. I've got to live my values, which is not really quite what we're trying to do, but maybe it's a little bit closer. But it's not to be critical. It's just an observation once again that this philosophy, I suppose, or way of living or understanding can be effective, and useful, and know that I'm also human, so I can kind of, not be so mindful and get entangled and be back in that world of I forgot. And maybe that's okay too, and healthy and
normal,
useful. It gives a comparison too, so I can remember what is important, so that when I'm caught up, it's not futile as well. There's something about the process, I think, that is important to remember about, not even ACT, about life. Life
exactly.
is a process.
Yeah, it sure is. And I think that allowing ourselves to be human, and I find myself these days talking a lot about just our faulty brains. Like, these things happen. They're not our fault. They're, this brain of ours that wasn't designed for us, really, that doesn't have all the parts that speak well to each other, that's, 70,000 years old for all intents and purposes. I love that ability to allow ourselves just to be human. Yeah.
How do you think you have changed and your therapy has changed in the way that you engage with clients has evolved, in these 5-6 years?
Oh. Well, it's been 13 years since I had the cancer diagnosis, and I've been practicing for nearly 20. It's evolved so much. I think, I wanted to be a clinical psychologist who could assess and diagnose and treat, mental health disorders, and I, did that for a little while, and then, that deficit focus after a while takes its toll. And I've always tried to have diversity across my roles. I've never had really one full-time job. I've always had at least 2 part-time jobs because I like diversity, and I've probably experienced not more than my fair share, but similar amounts of burnout that a lot of people in our profession have, and particularly over the past few years, thanks to the pandemic. I think I've moved more away from the manualized stuff. I think I've gotten a lot better at sitting with the human. in that moment and that day. I've gotten less caught up in the story of what a psychologist does and what they're supposed to do. And now I'm able to just sit and be and know and trust that I have a massive toolkit, and that no matter what you come to me with today, whether I can help or not is another story, but I'll be able to sit with you and we'll be able to figure out, what's happening and what could be useful. So I don't feel the need to, it's not that I don't prepare. Of course I do. But I've moved more towards, we talk about, and I heard one of your guests say this so succinctly, and I use this in my work as well, where, we're often focused on that, scale of -10 to +10, with 0 being, good in the middle. And often we're working with people who want to get from the -10 to 0. I've really changed to the focus of let's go from 0 to the pluses. What can we add, regardless of what's happening in your life right now? What can we add to help you start to head towards, a life that's flourishing? And I think, we know individuals who flourish mean families who flourish, mean communities who flourish, means a world that flourishes. And that I'm just so much more into that right now than the opposite. And whether that's a big part of that is self-preservation. But I also think we can't all wait until we get to 0 to start living our lives. Now I'm just talking off the cuff and probably not making any sense.
No, absolutely.
So yeah,
I'm hearing this, sitting with the human, creating space is very much an acceptance model. It's a non-judgmental space, and that requires real understanding and I think harmony in a psychologist themselves to be able to not try and fix, to not do solution focus, to be present and model in a therapeutic way actively in session, that the urgency of fixing might come afterwards, but rather understanding it. I mean, it's a very present moment type of work that needs to occur to accept, the humanness, the tragedy of the human condition, the fight, the tug of war, the suffering, the dukkha. There's all these competing experiences and demands as being human, before saying, let's now start looking at adding, because sometimes adding can feel like we are invalidating, or we're just adding. So we're just doing more of the same. We got here by adding, so let's just add some more, rather than, let's pause and stop for a moment and take stock before we try and be really considered, and conscious about what do I want to add and why. Why am I adding something?
Exactly. That's such a great way of putting it. I think that comes with a bit of maturity as well. And having, I don't know that I could do that before I got sick, before I'd really faced any real adversity in my own life. But I was also younger. But I love how you said that. It's made me think, because don't get me wrong, love me some good therapy. love schema work, love compassion focused therapy. I love ACT. I love doing therapy as well. But it's right. Why? Because how many people come through the door and they think they have to, delve back, on everything that's ever happened in their life and bring it all up, and unless they really are clear about that bringing value to their life, like, you know, why would we want to do that? And like you said, life's very, very busy. Why do we want to add more when probably the problem is that there's been so much? Let's just sit. And, you know, breath work is something I'm really getting into at the moment, and I'm doing some meditation teacher training as well. And just that whole space, that's where I feel good, I think. So that's where I want to sit and help other people sit too.
I wonder whether, and maybe I'm answering my question as I talk this through, but I wonder whether these events are the triggers, or they move us forward, or whether there is a natural progression toward maturity. You know, if I think about myself as a young person, you know, I've got so much energy. All I want to do is fix and help, and the solutions are there. So why wouldn't we just grab the solution and just do it, right? And in we get, and it's wonderful. You know, similarly, there are opportunities that presented themselves around grief and loss and pain and suffering that I took very little notice of. I wasn't able to internalize, you know, and then in this one little event, little is the wrong word, my apologies, one important event of so many that I let slip by, one I grabbed, which was my friends, and it was very distinctly different, you know. But I'm wondering whether maybe there was a maturity there that kind of meant that I was old enough, I'd seen enough, maybe the fact that I had children spoke to me differently. I don't know, but maybe there is something, because I just look around and age is something, right? You know, that there's something about age, and I love aging. I really enjoy. I think I've learned more and continue learning more, but not because the information hasn't been around. I think
because you're ready for it.
Yeah, I'm just available. I'm reading it differently. There's something going on, and I'm just questioning, at least now in my mind, you know, is it the diagnosis of cancer? Is it, you know, I've got family members who you know recently have been quite unwell and very concerningly unwell. It kind of says, hey, the end is near, and whether these are just reminders, but at the same time they've always been there. You know, it's just that as a kid, grandma passing away didn't mean anything. You know, it was you can't absorb it.
Yeah, and you weren't next in line in terms of the lifespan. And I think always about our, you know, the stages of development, adult stages of development, and that we're always developing, like regardless of how old we get, and we still have to meet our milestones, you know.
I like that.
Yeah. So you know, and I mean, the question is always both. The answer is always both, isn't it? Like, is it these events or is it the maturing? It's both.
Because it's kind of like a wine. And it's not a great analogy, because I don't believe in there being a good wine. I'm more scientific than that. But let's just assume that good wines happen with age, despite the disagreement there. It's not like the maturing would happen within the first 12 weeks or the first, you know, 12 months, or there's a certain month range where the maturing occurs. All the time has to happen, you know, that to mature, time has to pass, and that's,
and I think also experiences do need to be had, not necessarily the big ones, because some people don't grow, do they? Like very much.
Well, and interestingly, growth can happen at all times, right? Like it doesn't have to happen. You know, I'm blessed. I say with my friend's passing, he gave me the greatest gift of my life to date. This knowingness, this understanding, this mindfulness that was always available, but he gifted it in some way. At least that's my narrative, my story. But that was available, at least I have to believe in that. I have to believe as a psychologist that's available. And maybe that's that sort of positive psychology that you're talking about as well, is that we can add and look at those things with or without an event, so to speak.
Well, one of my
occurring.
favorite models, and I know it's been criticized, but it's the happiness pie. Do you know the happiness pie?
I don't know the happiness pie, please.
Sonia Lyubomirsky. I think that's how I say it. Anyway, the happiness pie. So she is very interested in what makes people happy, but more specifically, what contributes to the difference between what makes you, Nesh, happy and what makes me happy? And why am I happier than you, or vice versa? And so she's come up with this pie chart, and it's got 3 slices of pie. And so half of the pie, 50%, comes down to a genetic set point. So we all have a genetic set point in terms of how happy we will be in our lives. And then, I always just think about that in terms of being the nature and nurture debate.
Sure.
So then we're left with
not
the
changeable.
Other half.
That's the non-changeable. That's solid. Yep.
Although what we could, we can go into epigenetics and talk till the cows come home, but I'm not an epigeneticist, so I'm not going to do that. But the other half of the pie then is broken up into 2 slices. One slice is accounted for by life events, and the other slice is accounted for by our intentional thoughts and actions. So how we look at the world, how we interpret the world, the story we tell ourselves about the world, and then the choices we make in terms of how we live our lives. One's worth 40% and one's worth 10. Which do you think is the 10?
I would definitely like to think that life events is 10.
It is, yeah. So I think for me, I'd say to everyone, this is like one of the most exciting statistics we'll ever learn, that essentially half of what contributes to our happiness is within our conscious control. How we want to look at a situation, how we want to choose to behave in a situation, how we want to move through our life really is within our conscious control. And yet I think so many people, especially, when you're coming to see your psychologist, life events happen and we're moving through the world as if that life event accounts for 90% of the whole, story. So I always come back to that. And that's something I think of consciously daily, Okay, if I'm not feeling great, something's just happened, rightio, what can I do here in this 40% space? And there's always something. And I think, that's what I try to encourage a lot of my clients to do as well. And then what they do is, depends on what tools they need at that point. But just this clarity around choice, I think, is so important. Yeah. And I said earlier about, you get diagnosed with cancer and yes, you're in shock for a little bit and you go through, the motions a little bit. But then at some point, most people come out and they look for where they have a sense of control. What can I control? And there's a lot in terms of even, do I turn up to an appointment or not? What do I eat for breakfast? Who do I take with me to chemo? What am I going to wear today? So being able to shift that focus back onto what you do have control over and what can help, as opposed to being caught, that deer in the headlights and feeling as though you have no control over it, is they're 2 completely different experiences.
It's that space of acceptance and control where, accepting those things that cannot be changed.
That's exactly right.
Those things that won't be changed and making space for that, and then progressing from there, or simultaneously, or in some sort of strange soup of wrestling with that while you're also doing the things that you can actively change on, because it's not like one occurs and then you've ticked that box and now you can move across. It's much more complicated than that, but certainly a space of where can I regain my sense of control while I'm wrestling with potentially this other side. And in some sense you kind of did that. You wriggled through what you described earlier, of trying to find even just that one little glimpse of what can I do during my really difficult dark spots during chemo, which obviously was beating you down physically and mentally and emotionally and everything, and along with everything else. But then trying to even just find a little bit of what you could do while everything else was going on.
And, we've been focused on the active treatment part of cancer, but that's only one aspect. When we're talking about any chronic illness, that, somebody is carrying that all day, every day. So active treatments is, very specific part of the cancer journey, but, we know a lot more now about survivorship. And for me, the end of treatment and survivorship issues are possibly harder. Active treatment for me lasted a short period of time, and it was intense. But the rest of it never goes away. It's always there to varying degrees. And things like fear of recurrence, which ties directly into death anxiety, is there loud and proud for years afterward, and can really get in the way and can really immobilize you in your life. And they're those times where, you were just weighing up, where we both want to accept that at the moment I have a higher level of this kind of anxiety that sits there. But then on this hand, I can still choose to live my life and that doesn't always mean to the degree that we'd like to be able to, but there'll always be something that we can choose in there that can bring joy and the experience of other positive emotions, which can start balancing out the negative emotions. And, we start to move towards that plus side then, as opposed to be so focused on the deficit side.
So interesting when I think about the ACT space, that when your life has almost ended due to very serious disease, the preservation response is heightened. And we would kind of say that is also what gives rise to values of what's important. And that whole space about how we hold, which is really the crux of so much of ACT, of how do we hold something? Because if you hold a value so tightly, it becomes a rule. You suffocate it. And if in many ways, if you don't hold on to it with any gripping, that you don't act on it, because it can kind of be that way, or could be completely liberated, and then you just don't hold anything. But depending on what analogy and metaphor you use, and they're always complicated, but it's trying to find the right analogy that serves the story and the understanding that philosophy. But there's so much of a holding experience that's going on in terms of how do I now hold this? How do I hold this in such a way that it gives value? And that changes. I like the metaphor of at a dinner party or or some sort of hosting scenario. You actually can't be with all of your guests at any given time. You have your back to someone all the time, even though they're all your guests that you dearly love. But you just can't be with all of them. And if you try, you ruin it, because now you're up on a stand trying to speak to everyone simultaneously, and that doesn't add value either. You can only be present as much as you can be, in that moment.
I'm going to steal that. That's good. I was waiting for Joe the bum to come out, but No, I love that. And that's so true, isn't it? And so that's where the choice comes in. That happiness pie, that's where the intention is. In this moment, I'm with this person or this conversation in this way.
And there's an acceptance part when we think about weddings. A lot of people try and speak to everyone at a wedding. And in actual fact, all you're doing is pleasantries for everyone. So you've spoken to no one.
Yeah.
Versus, you've
true.
actually only got a select few, which is usually going to be maybe your parents, but, probably bridesmaid, groomsman, best man, etc. And you're not going to really get a good opportunity to talk to anyone at any length. It's just not the time and place that you're going to get any quality.
No,
you can only do it in small bites, but hard to do it when you're doing it the first time around.
Yeah. So funny.
What are you focused on now in your work? Where has life sort of moved to? Obviously, with all of your experiences, and you're still in Warrnambool.
Still in Warrnambool. I'm working at a secondary college predominantly. Can you imagine? I've been there for 5 years, and I have my private practice too. But where I'm heading, well, in 3 weeks, I'm heading to Port Douglas on one of my wellness retreats. So a colleague and I have formed a company called Being Well Collective, and we run wellness retreats based on positive psychology. So we've got this is our 4th one in Port Douglas in October. We're creating an online kind of self-paced positive psychology program that people who are looking to get into the pluses would really benefit from. I'm acutely aware of the ongoing long waiting lists to get in to see, people like us. And there's a whole kind of host of people who, might just have, a life stressor occurring and just need some tools for their toolkit. So we kind of just thought this is something that can help fill a gap at the moment. So that will come out. We've just recorded all of the content, so we're pretty excited for that. And we're moving into corporate wellbeing space because we see such a role, in big organisations, not even just big ones, but staff wellbeing, employee wellbeing is such a priority, and so many people are struggling in that space. And the legislation is all coming in now where our employers need to be looking after us and our mental health. So we're hoping to help out in that space as well. So there's a bit going on in my world.
Wow. What's the website for that one for any listeners that want to look it up and continue their
that one is so www.beingwellcollective.com.au.
Yeah, wonderful. And what do you do during these retreats, if you don't mind me asking?
Oh my gosh. Well, the first thing we do is create time and space, because anybody seeking some clarity needs time and space. And our retreats are fairly luxurious. And it's the kind of experience where you come and we have taken care of your every need. Things you didn't even know you needed to consider, we've already thought of. So we stay in beautiful accommodations. We do one in Bali each year and one in Port Douglas. We have morning, like a yoga class or a meditation session or a breathwork session, for example. That's followed by brekkie and a 2-hour positive psychology workshop. Get a workbook. So it's a very experiential thing that you go through over the long weekend or the week. And then usually there's, some downtime, some spa treatments. In Port Douglas, we go to Mossman Gorge for a beautiful, swim and walk through the rainforest. Then there's just a lot of you time, really. then lovely dinner together, and back to it the next day, kind of repeat. Yeah. So we curate our workshops to be a little journey. So it's kind of like an intensive, it's probably the equivalent of, 4 or 5 one-on-one sessions that you would get if you came to see me individually. But kind of in a way that people can go and take it away and apply it as they need to, but they've got the tools there to do it as they need. And yeah, we've had a lot of repeat people. Like half of the people coming back on this retreat came last year, so I think they're making it their annual trip. It's really lovely to watch people develop and embrace, the tools and change their lives and take the time for themselves. I think, choosing yourself and prioritizing yourself, especially when you're used to putting everybody else's needs ahead of your own, is such an important first step. So we just ask people to take that little step, and then we do the rest.
It's incredible how much the fundamental of just time and space is often neglected in our lives. That we're so busy doing work. It's responsibility followed by responsibility followed by responsibility, and because of that, there's very little time to reflect. And retreats, I think, are so valuable in that they actually say, well, you've scheduled time to not have these responsibilities, and so by nature of doing so, it provides an opportunity that you can begin to start reviewing, reconsidering, even thinking maybe again about your values. And if it's done so, obviously stimulated with some lessons about, the positive psych space or ACT, or, concepts like these pie charts, understanding these concepts, we're really just looking at what's going to stick in an environment, or so how can we make a stick environment to reconsider what's important, and then bring that back into life, because we've all felt so good after a holiday, and then said, how do I bring some of this back in? And there are clues there, and there's obviously value in saying, do it again, and be mindful, be observant. When do you start feeling these things? When are they valuable? Like, what is that 40%, the intentional thoughts, the intentional actions that will actually make a difference? So that sounds amazing.
I went on my first retreat. This is what made me I used to think retreats were where you went and sat around a campfire and held hands and sang Kumbaya, or you didn't talk. I had no idea really what retreats were. We always tell our guests there's lots of, coffee and cocktails, whatever you like, no deprivation. But I went, so after I was saying that I became, complacent again after the cancer stuff, and got caught back on that treadmill of busyness. Yeah. And I just need to stop. And I was invited to go on this retreat in Vietnam, and it was the most incredible thing I've ever done. And I took along Danielle Laporte's Desire Map book. Have you ever heard of that?
No, I haven't.
So Danielle tells us that instead of, so I'm like you, we're always do, busy, achievement. She says, instead of asking ourselves what we want to do, because what we probably all realize is, we'll achieve that thing, we get momentary satisfaction, and then we get the deficit in our dopamine and we go chasing the next hit. So next goal. And it's often just empty chasing. That's not true, but for the purpose of my conversation,
sure.
Let's go. So she says, instead, what if you were to ask yourself how you wanted to feel in your life? And so she walks you through this process, and look, it's not unlike, using our values as our compass, but she gets you to a point where you identify your 4 or 5 core desired feelings, like how you want to feel as you're moving through your life. And of course, you're not going to only feel those things, But it's kind of like, getting to that crossroads, and I could, go to that meeting after work, or I could, do this other thing that leads me somewhere that will make me feel happier. That's a really bad example, because probably you have to go to the meeting. But, you get to ask yourself, will I feel more of this? In the same way that we go, would I be moving towards my values? And my God, it's been a game changer for me in my life. And I came back from that retreat having completed my core desired feelings homework, and my 4 core desired feelings were to be, or to feel, more connected, purposeful, flourishing, and serene. And they just unlocked 3 major, doors for me. And one of those was the decision to start running retreats and moving into the wellness space, wellbeing space. So that's been a game changer. It's been amazing.
It's I'll add something cheesy.
Please do.
Hopefully no one takes this away, but it does kind of resonate. It's that difference between the human doing, where all these doing actions, I'm doing this, I'm doing that, responsibilities, and obviously that the term that we're all very familiar with is human being. But the being so valuable of how you are in that meeting. So if you use that example as the meeting, if you're doing the meeting versus the way you want to be in the meeting, and obviously that can be so profound, but trying to conceptualize that, understand that, practice that, chew the fat on that is really what time and space needs to go out and say, that's one small concept. I'm sure that there is nothing brand new about that. There are plenty of philosophies that speak about that, but how do you do it? It takes time, practice, patience, maybe some wisdom, maybe, experience, give it another go, reducing judgment. But that's what I'm hearing, is that you create a space where participants can be and reflect and think about these things, rather than getting caught up in the hundreds of do's. There's so much. It sounds wonderful.
And that's why moving away, like leaving home, is kind of an essential ingredient, because there's so many temptations, isn't there? We can always be doing something else when we're at home, another job, another task. So
yeah, my retreat, which I've just come back from, is camping.
Oh, I love it.
That is my world.
We didn't even talk about nature therapy. Yay.
We could do another 2 hours on just camping, being in the wilderness, being present.
For sure.
The bush TV, the campfire is the best.
My heart rate just slowed down even thinking about it. That's gorgeous.
But Jodie, absolute pleasure having you on the show today, and I just want to extend an incredible appreciation to you also being open and vulnerable and so kind and generous in talking about your own experience. I know that many people will hear your story and your experience and resonate to different parts of it and begin to think about their lives. I certainly felt touched throughout in different times. I think this is a really important topic. And I hope that it's not just a conversation that says, because of your scare, it's meaningful. That it's unique because of your diagnosis, but rather of saying there's an opportunity here, and clearly I see that in you. You have a positiveness, you have experience, you have a real understanding of process-based work and time and place that hopefully comes out more, rather than I listened to this podcast and there was a lady who was diagnosed once upon a time, and the whole survivor story, and so it's far deeper, and I think far more reaching than that. So I just want to acknowledge that and thank you for sharing today. It's been absolutely a pleasure.
Oh, the pleasure is all mine. Thank you so much for inviting me on. I'm absolutely tickled.
And all the best with your retreats as well.
Thank you so much.
If you enjoyed this podcast, please support it by going to iTunes and putting a review, subscribe, share it via social media, and tell others about it. Start a conversation. It's listeners like you that make this able and possible, and why we bring in these guests to go out and share their knowledge and resources. And just lastly, if you are a psychologist and you want to go out and be part of a bigger team, develop your experience and get into some exciting work, come to strategicpsychology.com.au/careers and reach out. I'd love to hear from you.